folks, this is Ashley, and I'm here to talk to you guys today about birth doulas. So this video is going to cover the basics of who birth doulas are and what do we do. So that's the first question I always get from people when I say I'm a birth doula. The big question is, what's a birth doula? I've never heard of that. So for those of you that don't know, a birth doula is a person, generally a woman, who is professionally trained at providing labor support for moms and their partners. And there are really four primary facets of birth doula care. The first is emotional support. So a doula is a person who's going to be there for you in the prenatal period, during your birth, and in the postpartum period to provide emotional support for you. So to help you through those difficult things, questions you might have during your pregnancy, to reassure you during your labor, to encourage you, to keep you focused, and in the postpartum period to help you deal with any of those issues that come up, help you navigate parenthood, and really be there as a source of support and encouragement. The second primary facet of doula work is informational support, and this is a big one. So a really huge part of being a doula is really doing thorough research and being up to date on all of the current information. So that means a doula is a person who's going to comb through the research, look at peer-reviewed information articles, and have a good, sort of cache of this information, and be there as a source of that information for you. So in the prenatal period, that equates to a lot of really good prenatal education, information about the anatomy and physiology of labor and birth, information about the sort of physical and emotional aspects that accompany birth. During labor and birth, a doula is there to help you informationally with things like, say you're interested in having a certain intervention done. For example, maybe a midwife suggests that they rupture your membranes. A doula is a person who's there to say, so here's what the research says. Here are the pros, here are the cons. These are reasons that it's sometimes done, and these are some considerations, so that you have a really thorough bit of information that you can use to make really good decisions that you're going to feel comfortable with, during your labor and birth and afterwards. So in the postpartum period, a lot of what doulas do is help with breastfeeding support, a lot of good information about how do you breastfeed, how to navigate those little hiccups, and new baby care, postpartum maternal care. All of this information, these little questions that you might have, that you might not ask your midwife or doctor, and you might not feel comfortable asking a friend or a family member, your doula is there to help you with those things. The third major facet of doula work is the physical support aspect, and this is really most pronounced in the labor and delivery. So in the prenatal period, the physical support comes by way of a lot of rehearsal, right? So we're going to rehearse different comfort measures we're going to use to help you progress smoothly and stay, low risk and well during your labor and birth. During the labor and birth, the physical support is major. So a doula is going to help facilitate position changes, different comfort measures like massage, acupressure, and really help you with that physical support that makes laboring and delivering much, much more comfortable and much more smooth. And in the postpartum period, a doula provides physical support, primarily with breastfeeding. So helping you physically get baby into different positions so that you can breastfeed effectively, comfortably, and be really on a good foot in that respect. So the fourth, and sometimes the most underestimated aspect of birth doula care is the support that a doula can offer the husband or significant other or other support person who's there to help mom while she's laboring. And this is really important. So a doula is there to kind of help focus the partner, help reassure the partner, again, provide them with this other stuff too, like emotional support and information, and make sure that they're eating well and drinking well and getting rest, but really to reassure them that this is what labor is, this is what birth is, and this is all normal. And again, I think that that's a really underestimated part of being a doula, and it's a really important role as well. So those are the four primary facets of doula work. And there are are some special considerations to keep in mind when you are looking for a doula. So one of the big ones is you have to know what a doula doesn't do. So a doula is not there as your medical support provider. That's also a big confusion. A doula is there, again, to provide that physical, emotional, and informational support, whereas your midwife or your doctor is there to provide the medical care. So while they can keep an eye on your medical well-being and baby's medical well-being, the doula is there to help with all of that other stuff. So all of that other support. So one doesn't take the place of the other. In fact, doulas work together with midwives and with doctors to support moms. But of course, the primary focus for a doula is always going to be supporting mom, baby, partner. So again, a few things you want to keep in mind when you are choosing a doula. You want to interview, I suggest more than one. And you want to ask questions about where your doula got her training, because there are all different pathways to becoming a doula. So for some people like me, I went through a formal training through an organization called DONA, which is Doulas of North America. It's just one of the certifying bodies that's out there. It happens to be the largest, and it's an international certifying agency, but there are plenty of others. And there are also doulas who don't have this kind of formal certification or formal training, but have a lot of experience with apprenticeships, and their support is invaluable as well. One is not necessarily better than the other. And the most experienced doulas will generally have a combination of some sort of professional credentialed training and a good amount of experience. So you want to always ask your doula, what is your background? How did you become a doula? And bear in mind that there are many really great and legitimate pathways to becoming a doula. The second thing you always want to ask the doula you're interviewing is how much do you cost? Is what is your fee is an important one, and what does that cover? So for a lot of doulas, myself included, I have one flat fee for doula services, and that covers, in my case, I do 2 to 3 prenatal visits, attend the labor and the birth, the entire continuous presence at the labor and birth, and that's a key aspect of doula support. The doula is there from the time you're ready to have her there until after your baby's born, and you're settled in, you've established your breastfeeding, and you are in the recoup phase. So continuous support during the labor and birth and in the immediate postpartum period. So a doula is there to help you really get a good start feeding your baby, to make sure that you're doing that basic care stuff for yourself, eating, drinking, getting rest. And then in my case, I come visit my clients the day after their babies are born, make sure that breastfeeding's going well, answer any questions, talk about new baby care, and make sure, again, and I keep saying this, but it's an important one, make sure mom is eating well and taking care of herself. And then there's one follow-up postpartum visit within a couple of weeks of the birth. So for me, 2 to 3 prenatals, birth, and 2 postpartums. Now, that will vary from doula to doula, just like with care provider to care provider in terms of a medical care provider. Each provides different care and different services. So ask your doula, what do they charge and what does that cover? For some, there are different fees for different aspects of the support. Some charge hourly, although I would dissuade people from doing that. But ask. And then finally, and most importantly, you want to choose a doula that you feel really comfortable with, because this person's going to be there to support you throughout your labor and at a moment that's going to be one of the most significant moments in your life, and certainly a very, very sacred moment. So you want someone that you feel really supported by and really comfortable with. So these are some things to keep in mind when it comes to choosing your doula. If you have any questions about doulas or about anything about birth doulas, feel free to leave a comment and I will try to answer that. So our next video should be up tomorrow, and it will be about how to choose a care provider. What are the different considerations there, and what are your options? So stay tuned for that, and until next time, thanks.